Across the country, we are seeing more and more young people come to medical facilities like here, seeking help for mental health issues. Just here in Cincinnati alone, the emergency room has well over 8,000 children each year come in because of a psychiatric emergency. These are young people that are frequently presenting here for either depression, anxiety, or aggressive behavior. Each year we've seen these increase over the last 20 years. This isn't just a Cincinnati phenomenon, it's really across the country. Throughout the United States, more and more young people are coming to emergency rooms or emergency clinics seeking help. Now, a lot of people ask, why is that happening so much now? We really don't fully know the answer, but what we do know is that historically, the vast majority of young people who had mental health problems never got the care they need. And only really about 1/4 to 1/3 get treatment. What we are seeing, I think, in a positive way is that stigma is decreasing. The idea of seeking help, the idea of seeing a counselor or taking medications, those barriers are less now. And so we're seeing more people come to the forefront. And what we do notice are the systems that really offer care to people, more and more people show up each year. And so what we're trying to do, and this is where I think as parents and as communities, we all need to work together to really improve those systems that can really kind of help meet the needs of young people who maybe are struggling with depression, anxiety, thought problems, adaptation at home or at school. By working together, we can really provide the programs that people need really to prosper and to overcome these difficulties. As we work with young people, we know they come from many different backgrounds. And some are struggling with whether it's family or home, and they may not have the supports that we would typically envision for young people or a family situation. So it's important that these young people find ways to connect with adults. And there are oftentimes, whether it's a coach or a teacher or a mentor, that we can oftentimes match a young person with a family. Parents themselves oftentimes do suffer with mental health problems of their own. They could be problems with substance use issues. It could be problems with depression. These are all things that interfere with a parent really being available for a child. What's very important is that we as a community come together to help support those children. And what the data clearly shows is by providing an adult who believes in that child is perhaps one of the most important things we can give them. Young people, even though they may come from a disruptive family, can oftentimes really have great outcomes if they're able to find those adults that believe in them and then also get the treatment they need for their underlying mental health problem. So any school we go into, we see a whole variety of backgrounds. Perhaps the most involved parents, to young people who don't have any parents at all, or young people whose parents are disengaged. It's important that we look at those issues, try to work with families to bring them back together, and if not, find alternatives so that young people can get the care and the nurturing that they need. Mental health problems really extend throughout our community. We see it in many different backgrounds. We see it in families that are oftentimes from very prosperous means to even people who are perhaps in deep poverty. So we see it across not only people who have different levels of resources, but also different backgrounds. And it really affects all communities, whether it's African American, Asian, whites, it doesn't really matter. We see depression, anxiety, problems with moving ahead with your life, whether it's academically or socially, really in all communities. The important issue is that the background of these people may be different, but they all are able to be treated effectively and improve. And so it's important that we really look throughout our community, through all sectors, realize that there's different stressors where you may be, but these are stressors that oftentimes lead to children to having major, significant problems. And outreach is very important, no matter what the community background may be. We also see that there are certain young people that really struggle with bringing issues forward. Oftentimes young males especially are oftentimes don't want to talk about their issues or bring them up. We also see this in young girls, but it's so important that we take the barriers down. As 1 in 5 points out, really out of every 100 children, 20 have a diagnosable condition at any one time. And perhaps even more tragically, 10 out of those 100, one-tenth of young people are disabled because they have a mental health problem. Mental health problems, as we noted, are very common in young people. So any classroom I go into, at least 1 or 2 children are suffering with major depression at that period in time. There's maybe 2 or 3 more that have attention deficit hyperactivity disorder. There's other young people that have anxiety. Again, these are all conditions that are treatable and can improve with care. The important thing to realize with these very difficult numbers is bringing them to attention is the most important matter, because treatment works. Young people who are suffering and struggling with mental health difficulties or behavioral problems or difficulties in the home environment can really do so much better if they receive the help they need. As we talk about working in these issues, it's always important to realize that treatment really can help improve the lives of young people. Treatment works, and that treatment can take on many different forms. The therapies we have, talk therapies that really have been developed, have been shown to be very effective in treating issues around anxiety, depression, worries. And there are new and new therapies all the time that have really been shown to be evidence-based, practical, and very important in really kind of helping the healing process. They're very effective and not necessarily easy to do, but oftentimes in a short time frame can really help turn around someone's life. We also utilize other types of treatments besides talk therapies, and sometimes that can be medication. The medications we have now are safer than ever before, and when utilized in a way that they're monitored appropriately and part of an overall treatment plan, can really help someone oftentimes improve from the depths of depression or anxiety problems or disorganizations in thought or problems with attention. So really our therapies now, and combining them in the appropriate way, we're in a better spot now than we've ever been before, and really helping people improve and having the pain of mental health difficulties really be more of a memory than an everyday reality. Many of the things that we really want to kind of keep an eye on for young people are problems with really issues around mood or behavior. Or one way to think about it is that we all have 3 jobs. And that is, as an adult, I have a job where I go to work. I also have one of my other jobs is really to be a member of a family and do added to it in a positive way. And a third one is really to have a productive social life that helps me and other people grow. If you're a young person, really you have the same 3 things. You have school, where you're actually expected to do work and gain skills and learn. And then there's also with your friends and being involved in activities or social gatherings and learning how to do other things outside of a regular school environment. Then of course it's being part of your family. When those things become problematic, when you really can't accomplish or do those things, that's when we really become concerned, because it's really you're not able to kind of really function and take care of the business really a young person is supposed to. So some of the things that can interfere with that one would be depression. Depression is really kind of characterized by oftentimes feeling sad. It's a period of time where it's hard to enjoy pleasure. So when you feel like you're kind of going through the motions, or you're unable to kind of really have fun when you're with your friends, that's a very important sign to pay attention to. Other times there can be problems with your sleep, your appetite, your concentration, problems with energy level. And then of course, when you have thoughts about self-harm. And that form can be either self-harm to cause yourself pain, or in more severe cases where really severe thoughts about wanting to end your life. When you're having those types of experiences, that's so important to make sure you raise that concern to adults. Other problems that we oftentimes see are anxiety problems. where we see young people that have worries or they're obsessing about something in the future. A lot of times there's worries about perfectionism, where they're oftentimes under a lot of stress to perform well, do well in school, get good grades. And a lot of times that pressure can build, cause people to worry, be concerned, feel that they're not good enough, and then struggle with really kind of feeling capable about what they can accomplish, but also how valuable they are. And that feeling of not feeling valued or feeling like somehow you're a burden to others is something also to pay attention to. We can also see young people that have problems with really kind of fulfilling academic skills. And so it's hard for them to pay attention, hard for them to concentrate or keep things in memory, to be organized in what they're trying to do. And so those are, again, problems that are very common, but also all very treatable. When we talk about young people that are having these types of problems, there's really many people that can really help. First of all, the idea is really reaching out for help. And so it's so important to really let people at your school or at home know, and to really tell an adult that there's a problem. So that's the first step. The first step is to alert an adult so that we can see about getting you help. Now, the people that can assess that can oftentimes be of many backgrounds. It could be a physician, such as myself, that specializes in mental health problems. It could be a psychologist, whether they're based at school or someone out in practice. It could be a social worker, or it could actually be a clinical counselor that can help. School nurses often have background and training in dealing with these issues and can oftentimes get you the help you need. The best way to really help young people is, first of all, to be understanding. The idea that we don't want to stigmatize these issues is oftentimes someone who's struggling with a mental health problem or a brain disorder is really struggling with kind of taking care of their daily activities. They may not be taking care of themselves as well. They may not be able to really perform as well in school. They may struggle with being short or negative at home, and even friends, they may continue to struggle with dealing with them. So sometimes people are giving us messages where it's just really hard for them to function. So the first thing is to not be judgmental about it. It's to really sit down and ask questions about, what might be bothering them. Is there something that is really causing them pain? Is there something they're worried about or they're concerned, or some problem that is causing them not to feel as satisfied with their life as they should? So the first part is to listen. The next part really then is to seek help and to work with a professional perhaps or a counselor to kind of really further understand the problem, get them to the type of treatment they need, and really kind of consider what all the treatment options may be. That may be counseling, it may be support groups, it may be engaging in different types of recreational activities. Sometimes it could even be medicine. The thing we really want to focus on is really adults and parents, getting them to the people that they need for treatment, and then really engaging with them in the treatment as it proceeds. So often when we work with young people that have these problems, having that involved adult, one who really believes in the child and one who can be accepting of their problems, but at the same time help them seek answers, really is perhaps the most important part of healing. People are trying to really be the person they want to be in the future. So as a young person, you want to control more things about your life. And oftentimes that puts you in sometimes conflict with your family. As parents oftentimes want to be protective, and they set rules and guidelines. And it's not uncommon really as a child grows up or a young person is growing into adulthood to oftentimes brush up against that. One of the things that parents ask a lot is, what is the difference between kind of normal young people growing up and becoming a young adult versus what's a problem? And I would say really what we get back to is we would expect some minor conflict, discussions, the idea that, who's really setting the rules, because that's part of growing up. You begin learning how to set your own rules for yourself. When it's a problem is really when we start seeing people not functioning in the roles they should be functioning in. And so if they're not functioning in the role of a student in a school and they're struggling academically, or they're not doing their work, or they're getting into problems, disciplinary problems at school. That should alert a parent that we've really now are in a position where this is beyond just normal adolescence. The same thing would be true with friends. If someone is having productive friendships, that's what we would expect. If all of a sudden their friendships are either absent or they're isolated or they're not really engaging with other people, that would be a problem. Or if the friends that they're picking out are ones that really aren't leading them to a productive next step in their life. So if they're picking friends that are involved in some type of disruptive behavior, those would be issues around social life we'd be concerned. And then of course in family, we're all part of a family, and that needs to be a productive interaction between the young people and parents. And one that maybe at times have minor discussions or conflicts, but really the core piece that they're bound together and that they're really working through a common goal. That's what we want to see. When you were at a point where it becomes more adversarial, more difficult, where their voices become raised or there's threats, now we're in a different ballpark and we have a problem. And that's something that really needs the attention to really solve that type of difficulty and conflict. We also see that there's certain young people that really struggle with bringing issues forward. Oftentimes young males especially are oftentimes don't want to talk about their issues or bring them up. We also see this in young girls, but it's so important that we take the barriers down. Talking about yourself and the struggles you have doesn't make you weak. It doesn't make you someone who's not worthy. Bringing forward issues so that you can improve yourself really are a sign of strength. Because what you're saying is, I want to do better, I want to get better. And by doing that, people can sit down, understand your difficulties, lend help, and oftentimes help you improve. When we talk about people there to help you, really there's a whole network of people, adults, who are there to try to really assist you. It could be your teachers, your counselors, your parents most importantly, but also perhaps school nurses. These are people that are really there to try to listen to what you say and then try to get you the help you need. So really, I'm asking you as an individual young person, don't keep these things quiet. Keeping this issue quiet is the worst thing that can happen. If you are struggling with something, please tell someone. If you see a friend that's struggling, please also alert someone for your friend. The idea that when you bring things up or really escalate the concern, when you tell adults, they can oftentimes contact the people like myself or therapists that can really help you really get through this difficult time and actually go on to have a full life where you're not struggling with so much pain and difficulty.